Hey everyone, welcome to Insight for Healthier Life. Today we are tackling a critical topic that concerns many travelers: blood clots. Specifically, we will be discussing why some people face higher blood clot danger after a long-distance flight or travel. We will break down why certain groups of individuals are at risk, explore the science behind it, and provide preventive strategies for each group based on their risk profiles. Stay tuned as we dive into this vital topic and arm you with the knowledge you need to travel safely and confidently. Our first group at risk includes individuals who have a history of blood clots. Now, if you have had blood clots before, like deep vein thrombosis in your legs or pulmonary embolism when clots travel to your lungs, you are already aware of how serious these conditions can be. The reality is, a previous blood clot means you are at a higher risk of experiencing another one, especially during long flights. Understanding this risk is the first step towards taking control of your health. Why are they at risk? Individuals with a history of blood clots are at increased risk due to underlying conditions that make them prone to clotting. These can include inherited clot disorders or damage from past clots. Prolonged immobility, such as during long flights, can worsen the situation by slowing blood flow in the legs and increasing the chance of new clots forming. For scientific support of this assertion, a recent study by Hart J.A. published in the New England Journal of Medicine underscores the heightened risk of clot recurrence in those with a history of blood clots. Understanding these factors is crucial for managing and mitigating your risk. Preventive strategies. First, consult your doctor. Before you embark on your journey, have a conversation with your healthcare provider. They might suggest wearing compression stockings or taking blood thinners to reduce your risk. Second, stay active. Keep your blood flowing by doing leg exercises and walking periodically during your flight. Movement is key to preventing clots. For additional tips on preventing blood clots during long-distance travel, check out our recent video on this topic. Next, we have pregnant women. Traveling by air during pregnancy can be safe, but timing and understanding the risk are key. Long flights, particularly in the later stages of pregnancy, can elevate the risk of complications such as blood clots. Specifically, the risk of deep vein thrombosis begins to rise around the 24th week and peaks during the third trimester. Stay informed and planning accordingly will help ensure a safer journey for both you and your baby. Why are pregnant women at risk for blood clots? Pregnant women face increased risk of blood clots due to a combination of hormonal changes and physical pressure. A study by Dr. M.T. Green and colleagues in obstetrics and gynecology highlights two key factors. First, hormonal changes. Elevated levels of hormones like progesterone during pregnancy enhance blood clotting. This natural increase helps prevent excessive bleeding during childbirth, but also raises the risk of clot formation. Second, reduced blood flow. Long periods of immobility, such as during a flight, can decrease blood flow in the legs. Additionally, the growing uterus exerts pressure on the pelvic veins, further slowing blood flow and increasing the likelihood of clots. Embracing these factors helps in taking proactive measures to minimize risk and ensure a safer travel experience. Any prevention tips? Choose an optimal time for travel. If possible, avoid flying during the third trimester, or at least plan your travel in the earlier part of the second trimester when the risk is lower. Also, consult your healthcare provider. Before traveling, discuss your plans with your doctor, especially if you have any risk factors for thrombosis or blood clots. They may recommend additional preventive measures or even prescribe medication if necessary. Our third group includes those with chronic health conditions such as heart disease or cancer. These conditions can significantly impact blood flow and increase clotting tendencies. For instance, heart disease affects the heart's ability to pump blood efficiently, leading to stagnation and elevated risk of clot formation. Also, cancer, known for its thrombogenic or clot-forming effects, can increase inflammation and disrupt normal clotting processes, making blood clots more likely. Being aware of these risks allows for better management and preventive strategies to safeguard your health. Here are the prevention strategies. First, manage your condition. Prioritize effective management of your chronic health condition before traveling. Collaborate with your healthcare provider to address any concerns and optimize your health. Second, exercise regularly. Enhance circulation by incorporating regular physical activities into your routine. Keeping active supports healthy blood flow and reduces clot risk. Third, use compression gear. Consider wearing compression stockings during your flight. They can help improve circulation and lower the likelihood of clot formation. Taking these steps can make a significant difference in maintaining your health while traveling. Our fourth group on the list is older adults. Older adults face a heightened risk of blood clots during long trips. As we age, blood vessels lose elasticity and blood flow slows, increasing the likelihood of clot formation. Chronic health conditions, which are more common in older adults, further amplify this risk. A study by Ken S.R. and co-workers, published in the Journal of Thrombosis and Hemostasis, underscores this concern. But what are the preventive strategies among the elderly? First and foremost, stay mobile. Keep your blood flow by engaging in leg exercises and taking periodic walks during the flight. Next, hydrate well. Maintain proper hydration throughout your journey to support healthy circulation. In addition, consult your doctor. Before you travel, discuss preventive measures with your healthcare provider to tailor strategies for your specific needs. Taking the fifth spot is obese individuals. Individuals with obesity are at a higher risk of blood clots during prolonged travel. But why? Excess weight can put additional pressure on veins and reduce blood flow, increasing the likelihood of clot formation. Obesity is also associated with chronic inflammation and alterations in clotting factors, leading to increased risk of blood clots. What can you do? First, maintain healthy weight. Aim for a healthier weight through balanced diet and regular exercise. Second, move frequently. Incorporate in-seat exercises and take regular walks during your flight to boost circulation. Third, wear compression stockings. This can help enhance blood flow and reduce the risk of clots. Taking these steps can help manage your risk and ensure a safer travel experience. Let's focus on the special population with respiratory condition as our sixth group. For individuals with respiratory conditions like COPD or asthma, air travel requires extra precautions. If your oxygen saturation falls below 90% at rest, consider avoiding flights. Low oxygen levels can exacerbate respiratory issues and pose additional risk due to the reduced oxygen in an aircraft cabin. If oxygen saturation is between 89% and 93%, supplemental oxygen is recommended during the flight to maintain adequate levels and mitigate complications. Be aware that poor oxygenation can also contribute to blood clot formation due to reduced oxygen delivery to tissues and decreased mobility, amplifying clot risk during long flights. What is the recommendation? Before flying, Work with your doctor to assess your oxygen needs and ensure you have the necessary measures in place. Proper management of your respiratory condition can help you travel safely and comfortably. In this video, we have explored 6 key groups at higher risk for blood clots during long-distance travel and shared practical strategies to reduce those risks. Remember, this list isn't exhaustive. Any traveler can be at risk of clots after prolonged periods of sitting. Whether you are a frequent flyer or planning a special trip, being aware of this risk and implementing preventive measures can greatly enhance your travel safety. If you found this information valuable, give us a thumbs up, subscribe for more health insights, and hit the notification bell so you stay updated with our latest content. Share your experiences or questions in the comment sections, as we are eager to hear from you. Wishing you safe travels and good health on all your journeys.